Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. And here we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I am your host. As you can see, today's topic is 10 reasons to see the foot doctor. And I have with me my special guest, Dr. Maya Atta. She will be introducing herself a little bit in soon. Again, please share the show. Please share the show. As I always say, my disclaimer, I'm a provider, but I'm not your provider. So please do not make any changes to your regimen without checking with your own provider first. That also goes from Dr. Maya Atta. Alrighty, and please make sure share the show. Share the show. I'm six members away from hitting 1,000. So if everybody who's watching tonight, if you can just invite one person or like as many people as you want to, just please try to get me to 1,000. Okay. So without any further delay, let's get to. We'll ask Dr. Maya Atta to introduce herself and tell us a little bit of what she does, and also give her a connection to Liberia too, because I consider her to be my surrogate Liberian sister. For
Well, I think I am. I
sure.
deserve that. um, as Abby said before, my name is Maya Atta. I am a podiatrist. That is what I did my training in, my education in. Did my training, um, and let's see, how long has it been now? Coming up in May, it'll be 30 years since I graduated from podiatry school. So that's a little bit about me. Now, what I do want to point out to you is exactly what podiatry. Podiatry is a specialty in medicine that deals with the lower extremity, particularly the feet and ankles. And it's everything um, included in what we do. Um, and in addition to that, we call um, foot manifestations of a systemic disease, things like uh, diabetes and circulation issues, high blood pressure, um, um, so that we can make sure that your whole body is healthy. You know, and sometimes those things show up in the feet. And on some occasions, podiatrists will be the first people to diagnose when you have problems going on that you may not be aware of. Um, and one of the big ones with that is heart disease um, and circulation issues. So that is what I do. That's what we do in general. So let's get to these 10 reasons.
Okay, so
Number one,
go ahead. I'm just going to put it on the screen. Okay.
um, okay, okay. So yeah, foot pain is not normal. Um, Matter of fact, you might be surprised to find out that really the way the structure of your feet can affect the whole rest of your knees, your spinal cord comes into play. Um, so if you're having pain with your feet, um, it's a good idea to get into to see a podiatrist, get referred to a podiatrist by your primary care provider. Um, some people need referrals and some do not. Um, and that can be really helpful for you because there are a whole lot of things that can cause pain and it can be different kinds of pain. Um, Pain in your joints is different than nerve pain. Nerve pain is different than the kind of stinging and that kind of stuff that you can get from other um, ailments. So as always, everything, and ankles as well. Ankles as well. It's important um, that you have good alignment. the you'd be also probably surprised to know the number of bones in each foot. So we're talking about 28 bones in 1 foot. Okay, and each one of those bones has a joint, and each one of those joints needs to be in alignment. And we do uh, certain measurements, and walk, observe the way you walk, and try to figure out what your pain is coming from, and whether or not it's just a matter of making sure that your joints are in alignment and functioning properly. Abby, do you have any questions about that?
Um, no, I'll be asking. I will go to the audience periodically and all that too. That way we can just go and you don't lose your train of thought. There. Also, because let me tell the audience first that we do a lot in primary care, but sometimes we know we have to send patients over for certain things, and there are times that we have to refer patients by law anyway. So if it's outside our scope of practice, then we refer to the specialist and all that too. So Maya podiatry is also part of the health team. So we have so many people in the health team. That's why I've been bringing different people to you guys. I had spiritual care last week. I had the cardiologist the other week. The other important part of the team is also the podiatrist. So when you're talking about pain, so when you're saying pain in the feet and all that, like what kind of what should be prompt the person to come and see you or to come and see me first before I give them a referral? Is pain over a short period of time, sharp pain, dull pain? How would you? What kind of pain are you describing there? Are you talking about?
It depends. Well, of course, the biggest one is going to be injuries. Whether you sprain your ankle, you stub your toe, you drop something on your foot, that's kind of immediate pain. And depending on how severe the injury is, your first contact might be the emergency room. For some people, it is, and for some people, it's not so severe. If you injure yourself and a bruise forms, then you need to make sure that you get in to see somebody because you're going to need X-rays for that. Um, Dull pain, it can be more indicative of joint problems, and so it may be something that develops over time. Um, and my next topic is going to be lumps and bumps, but so I'll get a little bit more into that.
Okay.
Um, uh, a lot of people, especially if you have flat feet, a lot of people experience heel pain that we call plantar fasciitis. Now, that kind of pain generally is one of those things that it doesn't hurt when you're not on it, but when you get up in the morning and take your first few steps, it's a very sharp pain to your heel.
Mm-hmm.
And then the more you walk around, the more it relieves. And so I think a lot of people think it happens once, it's not going to happen. And the next day it happens again. And the next day it happens again. And then finally, people will come in and say, I've been having this pain in my heel for, it could be a month, it could be 2 months, and I think that people feel like once the pain goes away, there's not a problem. Um,
Mm-hmm.
Diabetic pain, sometimes it's numbness and tingling in your feet. Sometimes it feels like pins and needles. Sometimes it feels like a kind of stabbing or burn. It just depends. It just depends. And my recommendation is that if you have pain, it's pain is never normal. Pain is a symptom, it's a sign, and that's everywhere in the body.
Okay. Right. I have, I think I told you before, I have flat feet. So a couple of years ago, when I started having problems with my heels, I was talking to the physical therapist that I work with. And I said, oh my goodness, I think because I gained weight, so my feet hurt. And then she was looking at it. She goes, no. And then she showed me how to do some stretches in the morning. So, talk about stretches before if the patient comes to see you. How would you like the first of the things you go with first before moving into more conservative measures and all that?
Generally, when people come to see me, that's the evaluations that I'll make as to whether or not they have flat feet. Um, because if they do have flat feet, one of the things that will cause that kind of pain, once again, is the alignment of the joints. And so So most people, if they have flat feet, at some point are going to need some kind of arch support. Now, for that, and that's probably one of the most conservative things that you can do. Now, custom orthotics are usually expensive and sometimes insurance does not cover them. So, what I generally tell people to do is go to your local pharmacy, Rite Aid or Walgreens or whoever, go to the foot care section, and they will have arch supports in there, not insoles. We're not talking about odor eaters or anything like that. I'm talking about actual arch support. Some of them will say back pain, or they'll say for knee pain or something like that. You know, sometimes they'll do that. Sometimes they'll say for heel pain. Um, I do not recommend, because they have those little cups that you can put in your shoes that cushion your heel. I don't
Mm,
necessarily recommend that because that doesn't take care of what the problem is. Okay. And so once you take your shoes off, then the same thing comes up. There is uh really kind of a band that goes between your heel to the ball of your foot. And what it really is supposed to do is maintain the arch. When you have flat feet, what ends up happening is that ligament kind of gets stretched over time. And the more it stretches, the more it flattens out your feet. Okay, and then that's going to cause pain as well. A lot of people, when they go in, if they get X of it, they'll be told, "Oh, you have heel spurs," but the heel spurs are not pain. What causes the pain is the stretching of that ligament. The heel spur, once again, is a symptom that that ligament is being from the heel bone.
mm. Okay. So, we'll go to number two.
Yeah, okay, lumps and bumps.
Mhm.
So once again, there are a couple of things that'll give you lumps and bumps, and I'll talk about the soft tissue stuff first. So most people are aware of corns and calluses. Corns are the ones that are on the top of your toes. Calluses are on the bottom of your feet. There's not really much difference in them other than their location, and they are caused once again by misalignment of the joints in your feet. Some people say that wearing tight shoes can affect that. Sometimes it does, but primarily it's your foot structure itself, and you get them because your foot is trying to protect itself from friction and rubbing on
Mhm.
the bottom and on the top. So you will see them. The What's normally done for them is is generally surgical, for the hammer toes themselves, because that's a misalignment of the joints. Again, you got three, except for your big toe. Each of your toes has three bones in them. So what ends up happening is that if this is my foot,
Mhm.
that's what a hammer toe looks like on the foot. Okay.
Mhm.
And so what's happening is that the tendons that go between the muscles and bones in your feet start to shorten, and that pulls them up like that. And usually, generally, the only way to get them to flatten once again, it's a matter of bone alignment mostly. And of course, most people are familiar with the bunions, which is the one that forms on the big toe, on the side of the big toe, right there at the joint. Um, and again, it's the same thing. For most people, they're not going to be um, treated well non-surgically. But I'm one who believes that if it's not causing you a whole lot of pain, to keep in mind that kind of surgery is bone surgery, has a recovery time um,
Mhm.
of months.
Mhm.
So it's something that you really need to take into consideration. If you don't like the way it looks, but it's not bothering you, then it's probably more advisable to do something that is more conservative, to get you an orthotic for your shoes so that we can try to do because some realignment can be done with custom orthotics. And because usually the younger you are, the easier it is to correct it without having to go the surgical route.
Mm.
But the older you are,
And they may
you
have
know,
to.
the other thing that can cause some bumps on the feet is, go ahead.
No, go ahead. Finish up your thought.
What were you saying, Abby?
No, I said go ahead. Finish up your thought.
One of the other things that can cause, okay, one of the other things that can cause bumps on your feet is if you have gout. Now,
Yes. Right.
gout comes from the buildup of uric acid in your blood. Okay. And what happens is when you get too much uric acid in your blood, um, the body will try to get rid of it. And that's very, very painful
Yes,
because
it is.
the, the uric acid forms crystals, and those crystals inside your joint is like having somebody stick needles in your joints. It's very, very painful. A lot of times you'll know that that's what that is because it happens most often in the big toe joint again. Very red, very painful. One of the things that they talk about is that sometimes it's so painful for people that it even hurts to on or put a sheet across your foot. That's how painful it
Mhm,
is.
mhm.
That generally, you know, for treatment. And once again, there's a couple of things that you can do to treat that. Depends on what it is. Some people overproduce uric acid in their blood, and some people have problems with their kidneys, and they're not. It's not going into their urine. If it builds up, and um, and that's what causes the pain in your joints. But it doesn't only happen in the big toe joint. That's the most common place, but it can happen in the middle of the foot. And after a period of time, you can get a bump. Really, it just looks like a bump underneath the skin. Um, and that if you're not in an active gout kind of situation, that's called a toe fuss, or more than one. That's not painful, um, generally, but that can be removed as well. Unfortunately, that's not one of those things that we can generally do because you know how they do. They kind of use a needle and a syringe to suck out the fluid. It's too thick. It's almost like consistency, so that doesn't work well. So, a lot of times if that happens and it's giving you problems, um, then they may need to open it up and kind of get it out of there. Now, what will happen with quite a few people who have gout is that once again, through your primary care physician or sometimes a rheumatologist, which specialize in different kinds of arthritis, um, they can put you on a treatment regimen for that, which is usually some kind of pill that will control or help the body to remove the uric acid efficiently from your
Yes.
system.
Yes, we put them there's 2 different kind of medications we
Um,
put them on, and then when it does become inflamed and really painful, then we put them on like a 5-day treatment to help with the inflammation and pain. So, it's important that they do take their
right.
medications, and getting gout can also be caused by certain medications or certain foods, so to tell you when if you do have that, the foods to stay away from and other things like that. Okay, so we will go to number 3,
Another
which is the big.
common lump and bump, there's something that's called a ganglion cyst. And those, once again, it is a buildup of fluid that comes from either your joint, one of your joints, or from one of the fluid that's around the tendons in your feet. Those, it really depends. Sometimes they don't need any treatment at all. Sometimes they'll go away on their own. Other times with that one, we can actually take a needle and kind of pull the fluid out and flatten it out. Sometimes there's a bone spur underneath there. And so in those cases, once again, um, it's kind of pain dependent in terms of whether or not to even bother the bone spur. A lot of people end up having problems with the way their shoes fit if there's a bone spur underneath there. So, we'll just go in and flatten out. And I think that might be it for lumps and bumps,
Okay, so we will go
unless we
to,
got any
let me see here. We'll go to diabetes. We'll do diabetes and then
diabetes.
I'll check the questions.
Okay. Um, Diabetes is um, a condition where one of two things is happening. Either your body is not producing enough insulin to break down the sugars that you eat every day. And there are a whole lot of things that people don't think of as being sugar, but it really is. Um, and either you're not producing it, or for whatever reason, your cells are resistant, and once again, that can be treated. The reason that is necessary, really, if you're diabetic, to see a podiatrist, is because there are three really major things that happen with diabetes. Um, Most people know that it affects the eyes and the kidneys. The other thing that it affects, though, is your nervous system. And so, what ends up happening is that some people, after probably about 10 or 15 years of having diabetes, people can develop what is called peripheral neuropathy, which can start out, like I said before, with the pins and needles sensation, some numbness. Um, One of the unfortunate things that it does in terms of the lower extremities, especially from the knee down, is that it affects what they call the microcirculation. So not your bigger blood vessels, the smaller ones. So it causes, and what will end up happening is that um, we generally will check pulses in your feet. Your primary care provider should be doing that as well, checking the pulses in your feet to see if they're there. Um, but it doesn't necessarily affect those blood vessels, but it affects the smaller blood vessels, the capillaries, and so forth. And that along with the numbness, can cause a breakdown of the skin and can cause skin ulcers. Um, Most people with these will get them underneath their sometimes the heel, and because of the numbness, you don't feel it. And you may not even know that you have it. So one of the things that we tell diabetics, especially diabetics who are also having issues with eyesight, um, is if you're wearing socks, to try to wear white socks, so that if your skin is breaking down, you can see when you take your socks off, that there might be some blood or some other fluid on your sock. And that can let you know if you're not having a whole lot of feeling in your feet, because those are not generally painful. Okay. Um, but the bigger problem, I mean, that's a big problem, because one of the things that it can end up turning into is amputations. And they can start out at a toe, and then the next
Hmm.
thing you know, it's in the middle of the foot. And then the next thing you know, it's the ankle. Then it's below the knee, sometimes above the knee. That really does happen. So that's a very, very important thing. That's one of the things that with diabetics, I usually recommend that they get in to see the podiatrist at least 3 or 4 times a year. Some people need to come more often than that. Um, the other thing that you can do if you do have diabetes, um, make sure that you are careful about wearing something on your feet, even in your house. Okay,
Yes.
because you could drop a pin or a needle on the floor, especially if you have carpet. You might not see it, step on it, might not even notice that you have stepped on it. So it's always important to protect your feet. Make sure that when you are taking a bath or shower, you make sure you check the temperature of the water, because you really can burn yourself if the water is too hot. So make sure you're checking the temperature of the water before you put your feet into it. If you got steam coming up off the water, if you're going to soak your feet or anything like that or get in the bathtub, it's too hot. Don't let it be that hot. Because generally by the time you got steam, it's over 100 degrees, and that's just a little bit too warm when you're already impaired with your feet. Other thing that's important, once again, especially for diabetics, is toenail care. Um, if you're diabetic, you should not be going to get a pedicure from a nail salon for your foot care. Nothing wrong with wearing nail polish and all that kind of stuff, but you want your podiatrist to be the person that is examining your toes and your feet to make sure that you don't have anything going on, especially if you have ingrown toenails. And a lot of people have ingrown toenails and they don't realize they have them until they get a problem where it gets infected. But if you have nails at home, you should be cutting them straight across. Don't try to go down in the corners and dig out the part of the nail that you feel like is digging into your skin, because most times, first of all, you're not your foot is not positioned in a way that you can actually see where the toenail is curving in. And because you can't do that, what ends up happening to most people who have problems with ingrown toenails and that kind of infection, and I know I'm veering a little bit, but is that you get a little hook that stays underneath the skin in that
Mm,
corner that's giving you the problem. And, that, will end up going underneath your skin and causing the infection. But back to diabetes and the problems with the numbness in your feet. The other thing that happens, which once again is major, is that there's a condition called Charcot foot. Now, Charcot foot, once again, is a result of the uh, the breakdown of the sensation, and once that happens, sometimes it can get to the point where the bones themselves actually start to break down. But it imagine, if you can, taking a styrofoam cup and just squeezing it until it breaks. And that's kind of what can end up happening with your joint when it gets to the point where you have Charcot. Once again, that's a very serious situation. You get into things like that where, now once again, if it can be corrected, we're talking about surgery. Another thing that a lot of podiatrists will recommend for their patients is to, if they get to the point where they're having some numbness and that kind of stuff, to get, I know nobody likes to hear this, but like an orthopedic feet, and particularly in your ankles as well. So that's it with diabetes.
okay. And you can also, if you want to, if you want, some of these topics can kind of coincide with each other too. Do you want any questions now, or you want to wait for a few more minutes after we go to number five? I think you're frozen. Alrighty, people. I'm waiting for Maya. I think. Okay, are you there? I'm just waiting there. So let me just look into.
Okay,
Okay.
you want me to
All
go
right.
ahead?
Yeah, one second there. Let me just see. I think I had a question that somebody asked about what's the difference between bunions and gout.
Oh, the difference between bunions and gout. Bunions are caused by what ends up happening, and this generally happens with people who have flat feet, or because the ligaments that hold your joints together are kind of elastic. Okay, and the more elastic they are. Now, what ends up happening with most people is that once again they start to get arthritis in those joints. The big toe starts to turn in towards the smaller toes, and that joint pushes out because the ligaments are not strong. So that is a out is what we call a metabolic issue. That has to do with the uric acid in your body accumulating in your things. Now, you can't. I have seen cases where people get. When I talked about the tophus, some people do get a toe joint after they've had several flare-ups of the gout, and it does look like a bunion, but it's also times where we've done surgery, and when we go in there, it just looks like, well, like I said, it kind of looks like dried up toothpaste, and we can clean that out, and they don't actually have a bunion at all. It's just gout.
Okay, you there? I'm just making sure you're not frozen. Alrighty,
I'm
so
still here.
okay. If you get frozen for a prolonged period of time, I guess we could just finish it up. It would You wouldn't mind doing that on the phone, just calling in, right? If we have any problems there. I'm just hoping that we don't have a long.
Okay.
Alrighty. So, oh, sorry, I'm trying. Okay, so let's go into. Let me see if there's any questions before I go. For those of you who are watching, we're talking about 10 reasons to see the foot doctor with Dr. Maya Atta. She's a podiatrist. So leave your questions and comments below. We'll try to get to some of them. We're just trying to get into order here. Glendy's watching. She said you're in your element. And let me see, other people are happy that you're here. So we'll go back to our questions there, okay? I think we're circulatory issues. I think you touched on some of that, but we can do circulatory issues. Let me see. Alrighty. Dang, you're frozen.
Okay, let's try this.
Did you want to call on the phone? Are you there, Maya? Let me see. Alrighty. Let me just look at the questions while we're waiting for Maya to come on. I'll go in here. Let me see some of the questions. Okay, go ahead and summarize. Okay, alrighty. So, okay, Maya, are you still there? We're just gonna go through some of these different questions here. I'm trying, and can you hear me?
Yes, I can hear you.
Okay. So, um, all right, we're like 33 minutes into it. Okay, so next one was circulatory issues. I think you touched on that already a little bit. Let's talk about for we can always put the whole thing in the documentation part later on. But talk about COVID toes. I think that's number 8. Sorry, people were just moving around, because of the internet service and all that. Talk about COVID toes. I was surprised to hear about that.
It's not all that common, but I think it's something that people do need to be aware of. If you're having symptoms of and you also look down at your toes and um, they have what we call petechiae. So it's like little red or purple dots on your toes, and your toes are swollen. That can be a sign of COVID. Like I said, so if you're having that in conjunction with the other better known symptoms of COVID, it might be a good idea for you to get a COVID test just to
Okay.
check and make sure.
Okay, so we will already. Jiggers in your toes. That's just I'm just moving around people, and then we can always add to it later on. Jiggers in your toes. Back when we used to call it jigger in your toes. So what are they?
Mm, well, you know what? They are the of a worm. So it's before the worm. It's a certain kind of worm before it's already developed. I was surprised to find out. I haven't had any experience with treating it myself, because I spent most of my time in cooler climates where this is not a problem. But even here in the United States, in warmer climates, I'm assuming in the southern states, probably where it's warm, it can exist. So don't think they're only back home. They're
So
in here, the symptoms are the same. They're itchy.
mhm. Alrighty. So how is that? How you treat jiggers in your toes? Like in warm. How do you take care of that?
Usually with some kind of soaking. I am not aware of
Mm,
whether or not they specific medication for it. I'm not sure. I can try to do some more research and find it, but for most it's because, like I said, because it's not something that I deal with. It's kind of out of my scope.
sorry.
You know, may be inclined to send somebody, especially if you're not in some place where people have a whole lot of experience with it. I might recommend a dermatologist for that.
Dermatologist. Okay.
And speaking, let me just talk about um, when you think what you think might be dry skin is not. Let me talk about that a
Yes,
little bit.
yeah,
Um,
that's
Now, some dry
notes.
skin, yeah. Um, Most people, again, are familiar with athlete's foot. What most of us think of as athlete's foot is the moist, cracked skin between your toes. Sometimes it's itchy, sometimes it's red, sometimes it drains a little bit. Sometimes you get these little bumps that have a little bit of fluid in them. That's what most people think of as athlete's foot. Now, um, there's another form of athlete's foot that we call chronic athlete that looks like dry skin on the feet. And so you may be putting all kinds of donut grease and this, that, and the other on the bottoms of your feet, and it's not going away, and it's not going away, and it's not going away. It stays there and it's flaky. And I said, it looks like dry skin. It could be athlete's foot, chronic athlete's foot. Now, way in this day and age, you do not need a prescription. That's number one. Number two, um, the other thing that I tell people all the time, you can get a prescription. It's far less expensive because it's the same medication. It's far less expensive, especially if you don't have insurance, to go over to the aisle where they have the medication for yeast infections, whether it's Monistat or any of those kinds of things, for two reasons. First of all, the tube antifungal cream that you're going to be able to get that's over there in the foot section, that's going to be a lot smaller. And it's not going to last as long as if you get the same medication for yeast infection that comes in the like
The bigger.
minus one of those kinds of things. Once it's the same medication, and and longer, especially if you have the chronic athlete's foot, because that takes a little bit longer to get rid of. Um, that if you have the acute one where you're getting the cracks underneath your toes and in between your toes and that kind of stuff, I recommend that you soak your feet for about 15 or 20 minutes in a little bit of vinegar and warm water, or you can use a little bit of not the ointment, the cream. okay, because the ointment is going to keep the moisture. If it's
See here.
moisturizer in there from.
Mhm. Are you there?
Did you get that?
Yeah, you cut off halfway through. You said to get the cream, and then you cut off, and you're mute in and out. Mhm. All righty, let me do this. Let's do this here. So, are you? One second. Okay, folks, let me just do this here because I think I can get her on my phone. All right, if it's possible, we can just finish it up. I'm just looking to see any kind of questions here. How can I be? No, sorry. I'm gonna go in here and sorry, one second, and then we can go back in because I think we just lost Maya. Alrighty, one second.
Okay. All right. Bye.
All right, hold. Okay, you there?
Yeah, I'm still here.
Okay.
Do I have to do anything different or no?
No, 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 no. You were just finishing up now. So since I have you on the phone, so we're talking about is that some dry skin or something more serious? And you were explaining that you can put your you can soak your feet in water. Can you finish that up?
Yeah, soak your feet in some warm water with a little bit of vinegar, maybe a cap or two full of vinegar. It doesn't matter what kind of vinegar it is. Um, or you can soak your feet in warm water with a little bit of dishwashing in there. It doesn't have to be bubbly, but just a little bit. And like I always say, check the temperature first. Then make sure that you dry in between your toes very well, and then put the cream in between your toes and on the areas that are cracked twice a day, and you should see some improvement. I've had some people who had it really, 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 really bad, um, but usually you'll see some improvement within a couple of weeks.
Okay. Alrighty. Sorry, we're jumping around, audience. There were some other things here. So let me just ask. Some people are asking some questions. Okay.
Sure.
Eugenia is asking, how can diabetes avoid amputation or limbs? Sorry, I'm late. I think we talked about the fact that diabetes, diabetes, like the leading cause of non-traumatic amputations. So,
Yeah.
just speak to that a little bit more. I think she came in late.
Oh, okay. Make sure you're seeing your podiatrist at least 3 or 4 times a year. Um, Make sure that you do things like um, get your circulation checked. Uh, Make sure that even inside the house you wear some kind of something on your feet, whether it's some slippers or something like that, because what happens with a lot of diabetics, because of the numbness, sometimes they don't feel when they injure themselves. It could be a pin or a needle or something like that on the floor that you don't see, and stick yourself, and then that can start the process of getting an ulcer, which can lead to infection. And especially it's really important, especially if you're having issues with neuropathy. Um, Wear white socks so that in case you step on something or something like that, or if you start to form an ulcer or get an infection or something like that, you'll be able to see the blood or the pus or whatever on your sock itself. You can't necessarily see that if you have on a colored sock. um, Sometimes, another thing, I don't know if I mentioned this the first time. Another thing that you can do is look at the bottom of your feet with a mirror,
Yes,
so that you can see if there's something there.
Yes, I tell my patients that I always at least once a week hold a handheld mirror and look there and look at your feet completely and see. Because when you're just looking from the top there, you can't see it clearly.
You can't
So
see.
yes.
Right.
So
Right. And the other thing is just make sure that you're doing things like checking the temperature of the water when you're taking a bath or shower. Make sure it's not too hot, because that can also cause problems. You can get burns that way, and so you want to do that. But those are the things that you want to do. Don't assume that because the circulation or the pulses on your feet, you can feel them. That doesn't necessarily mean that there has not been any damage to the smaller blood vessels in your feet and toes. So those are the important things.
And also for diabetes, for diabetics, it's important that you also, if you're on any kind of medication or you're taking insulin or the other different agents of medications you can take, it's important to maintain your to keep a healthy therapeutic A1C. For those of you who did not see my show on diabetes, I did that. Make sure your A1C, try to maintain it, at least you're type 2 diabetic. You make sure your A1C is always below 7. Okay, try to keep it as low as 7 and below, and go to your doctor, go to your primary care doctor, making sure you're getting your blood work done. If they tell you to follow up every 3 months to check your A1C, make sure you're following, making sure you're checking on your cholesterol level as well, because all those things work together to make sure that your diabetes is under control. Okay, so talk about a medical do manicures, because there's some people who are trained to do pedicure who are not they're like a little above, I think they're nurses, sometimes some of they're nurses, but some other people who are not just nail tech, but they're nail tech plus they do more, they train to do that. So if you want to get a pedicure and you're diabetic,
um I'm not sure how much of that happens in the US. um as much as it does, I know in other places, I know like in Great Britain, and a lot of the former British territories and so forth, they have people that are trained to do that. They're called chiropodists, but and they deal with like you said. I mean, they deal with you know, toenails, and you know, they sometimes deal with like trimming corns and calluses and that kind of thing, um, but not much more than that. The training is not extensive um, in the same way, and I don't think a lot of people are aware of the fact that podiatry really is kind of like dentistry in the sense that it's very specialized. It takes the same amount of time to get a DPM, which is a doctor of podiatric medicine, as it does to get an MD, DO, uh, DDS, any of those things. They take the same amount of time to do. And, you know, but that our focus is on that. Our focus is on making sure that people maintain healthy feet and lower extremities in general. Like I said, skin to skin. That's what we do.
okay, I think we didn't touch on ugly toes. Did we?
Ugly toenails.
Yeah.
Um, that's another thing you need to kind of concern yourself with. If your toenails are yellow and thick and you can't get through them with a regular nail clipper, sometimes people get like debris underneath their toenails is kind of flaky. That can be an indication that you have fungal toenails. So, and again, you should get that checked. Uh, because you know once it gets a point where it's in your toenails, you do have to be either one or two things. You either have to be medicated, or you have to have the toenail removed to get rid of it. And even if you have toenail removed, you're probably going to get some level of medication. But the medication that you get if you have your toenail removed, you can usually use one of the creams to do that. If you take medication, the biggest thing with taking pills for fungal toenails is that they really can affect your liver function. And so a lot of people will do that as a last resort, you know, because,
Yeah.
you know,
We
They rather just try to maintain your toenails, which again is another one of the reasons why you should be, if you cannot maintain them yourselves, you should be going to let somebody professional take care of that for you.
Yes.
Sometimes they can be thinned out a little bit, and so that it's not so much of a buildup of that, but they can be a little bit of a challenge to get rid of. The other thing that I talked about a little bit in terms of ugly toenails was the ingrown toenails. Um, if you have ingrown toenails, that's where the corners of your nails curl in on each other. Mm-hmm. And that's another thing that you need to really make sure that you're having somebody who knows what they're doing handle your toenails, because that's where you can get your infected ingrown toenails from, for one. And the other thing that can happen to some people, doesn't happen to everybody, is that they'll curl in so much that you get skin caught in between where it curls. And then when you try to clip your toenails yourself, you end up cutting yourself. And then, you're bleeding and so forth. So you need to be really careful about that. Now, another thing, once again, because, as we get into manifestations in the foot of systemic disease, one of the ways that you can know that you may have psoriasis or psoriatic arthritis is that you get these little pits in your toenails. That can be a sign of that as well. So there are things that come up.
Okay. And so for the fungus in the toes and all that too, what we do when we put patients on the medication, yes, it does affect your liver. So what I do, we see our patients, we order it for the first 30 days. And then we do the liver test after every 30. So far, it's like 3 months straight. So you have to do your liver test 3 times to make sure that it's not affecting your liver, because it's a very powerful medication. So some people can say, you know what, I'm just gonna not bother with it, and some people choose to go ahead with it. So that depends on how extensive it is and what it is that if you don't want to have it done. But usually, yeah, like again, go to podiatrist and also see your family doctor, and then we can go on from there. Somebody asked the question, why did they have to jump through so many hoops just to see a podiatrist? Most places, most reason for that is because of your insurance. Okay, so your insurance, you have to, if you need a referral, if you need other things and all that. So basically insurance and how much your insurance will cover, because some of the treatments can be a little bit pricey at times too. So they'll go on from there. So we can do a lot in primary care, but again, like I said, we go up until our scope of practice ends, and you have to see a podiatrist. So do you have anything else to add, or to just on your closing statement?
Let me just talk about proper footwear for a minute.
Yeah.
Because I think that's really important, especially if you're talking about athletic shoes. Depending on what you're using them for, you may need a different shoe. You won't wear the same kind of athletic shoes if you're playing basketball as if you are playing tennis. And the reason for that is that the way that the shoes are actually made is they're made to support certain functions of the foot. So you really need to know what you're planning to do. A cross trainer is pretty good if you do more than one thing, but if you do something specific like tennis or that kind of stuff, just like you wouldn't wear a basketball shoe to play soccer, it's the same kind of thing. That's one thing I want to talk about. The other one is, and this comes up a lot. Your shoe size changes. Okay? If you're not wearing the same size dress or pants or whatever that you were wearing in high school, don't come and tell me I've worn a size 7 shoe since I was in high school. Okay? Because that's not the case. Your weight can affect your shoe size. The width of your foot can affect your shoe size, and certainly you should not be squeezing your feet into any shoes. Now, I understand everybody wants to be cute, everybody deserves to be cute, but that should not be the only thing that you're wearing. And if you're going to wear the shoes that tend to be a little bit more painful, limit it as much as you can, because that's where some of these problems come from. Not to mention the number of ankle injuries that come from those 7-inch heels y'all like to wear.
That's also excuse. Wear your cute shoes and for I wear my cute shoes for pictures, and then I take it off and put my slippers on
Yeah,
or put something more
yeah,
comfortable on.
absolutely.
Yes.
Absolutely, because it needs to be a little bit more sensible. The older you get too, and this can be important, and even with, especially with diabetes, your balance is not as good. So you got lots of opportunities to hurt yourself if you're not wearing appropriate shoes.
Mm-hmm.
Make sure, especially if it's a closed-in shoe, make sure that whatever kind of shoe you're wearing has a good arch support and that is really flexible at the toes. Okay, because your toes form an important part of your being able to walk, so they need to be flexible.
Mm-hmm.
You know. Was there anything else? Do you have any questions, Adam?
No, I think I did all the questions. I most important thing was the footwear too, because also I did not know. Again, my physical therapist told us when I was doing my marathon, my one time I did it said make sure you're supposed to keep change your sneakers every year. I did not know that, and then also
Well,
being
we
when yeah.
recommend every 6 months, but
Yeah.
okay, six
Yeah.
months to a year.
Yeah, I
Yeah.
did not know that. I'm like, okay, my sneakers can still fit. Why shouldn't that? And also working as a nurse all those many years too. Again, I didn't change my shoes that much unless really needed to. And just the fact that my feet were so comfortable in the nursing shoes or nursing sneakers, wearing high heels after that, after all those many years, I'm not comfortable wearing high heels anymore. It's
Me
like,
either.
so it's like I wear something that's comfortable. And like I said, it looks cute and I take the picture and that's it. You got to see
Yeah.
my slippers on and I'm dancing. My cousin sees me say, "Oh my God, your shoes are ugly." I say, "I don't care." And I'm for comfort. I'm too old to be walking around being in so much pain. So, okay. So I think
Yeah.
I got everything there. And all the people who are watching along, I don't think any of the questions there. So yeah, so we've been on, and I don't want to hold you any longer. So anything you want to leave, any parting words, and so people can take that and say, "Oh, you know what, she said this, maybe I need to go see my primary care doctor, we can talk about it, and then maybe I need to go see the podiatrist too." So any important things that you want to leave with the audience?
Just basically, I want to end where I started, which is foot pain is not normal. If you're having pain, have it addressed, especially if you're having pain every day. I mean, it's one thing if, speaking of shoes, it's one thing if you say, my foot kind of hurts if I wear this particular shoe, then, either don't keep it on very long or stop wearing it altogether. But if it's something that is every day, you find out it's going on a week, 2 weeks, a month, then you need to have it addressed. And again, it's very important for diabetics, and it's very important for people who have other circulation issues to make sure that you're checking and making sure that everything is okay. And for some people, that might mean once a year, and for other people, it might mean every 2 or 3 months. It just depends. But pay attention. The same way that you should be seeing your dentist every so often, getting those mammograms if you're over 45, those kinds of things that you need to do. Just make sure that you're taking that kind of care with your feet and your lower extremity.
Okay, alrighty. That's important information for all of you. I must confess, I have never been to a podiatrist. I kept saying I don't need to go, but when my feet were hurting me, when I mean, having flat feet, I need to go and get evaluated. To make
You
sure,
do.
because especially as I'm getting older now, I mean, I need to like can be 35 forever.
Yeah, that's true too.
So it's like, so I need to go and get evaluated. That's what I'm doing. I'm planning on getting all that checked up and everything sometime this year. So thank you so much. Thank you so much, Maya. I really appreciate it. Sometimes this internet can be a little bit, so let me see any more questions here. What is flat feet? We talked about that before. Somebody is asking that question. Well, I can talk more about it. I'll put some pictures up. But anyways, so audience, thank you all for watching. I'm just gonna finish it. Maya, if they ask questions in the I always tell people we can continue the topic in the comments. So if there's anything, I can disk tag you if they need to ask you any questions. Will you be available to just kind of?
Absolutely.
Okay, good. So
Absolutely.
good.
Yeah.
So people, did you hear that? I'll be able to. You can continue the I'm losing my voice, topic in the comments there. Okay. So if you have any questions, I usually go back and, answer them too. If you're watching with Focus in Liberia, I usually go back on there too and answer questions. So please, 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 I hope you enjoyed the show tonight. Sorry for a little bit of internet interruption. If you like this show, please give us a thumbs up. I try to get more people on the part of the health team to be able to give more information, give more specialty information. Okay. So I love and I always appreciate everybody who volunteers to come on. It's really hard to get people based on our schedule and all. So I'm really happy when somebody agrees to come on. And I really appreciate Maya. I've known her forever now. Like I said, she used to live in Liberia before. I didn't know her then, but I got to know her on Facebook. And she's one of us. Okay. So so thank you again. Thank you so much. For those of you who are watching now, I say thank you. For those of you who will be watching later, I say thank you. Please, please, if you haven't liked and follow, if you hit the like button, also hit the follow button so that way you don't miss any shows. Okay. And during the week, I also put up different videos and all the 90-second videos. So healthy videos so you can continue the conversation. Alrighty. And I'm 6 people away from reaching 1,000 followers. So please, please help me out. Okay. So thank you all again. I wish you all really good rest of the week, and I'll be back on to put on some other videos. So have a nice day, stay safe, and God bless. And I'll talk to you guys later. Bye bye now, and don't forget hit like and follow and invite others. I have to get to 1,000 by the end of March. Okay. Thank you very much. Bye bye.